and we have our regular guest this time of the morning. We've got Dr. Joe Congini. Good morning, Dr. Joe. How are you?
I'm doing good, Gene. How are you today?
I'm fine. So what did you want to talk to us about today?
I wanted to throw you a curveball since it's baseball season.
Excellent.
A lot of people in my office get confused about this injury, Gene, and it's a labral injury, and labral tear, and right away people think that means shoulder because we've talked so much about shoulder labrum, and there's probably a 10-year lead period where people were talking about shoulder labrum before we started to understand more about the hip labrum, and there is a cartilage rim in the hip that is around the ball and socket of the hip that athletes are tearing and injuring at a much higher rate. And it's really confusing for a lot of athletes. It's also really painful and hard to play through. And when these people have persistent pain, typically a lot of times they'll have catching, they'll feel a clicking or a clunking or a popping in the hip quite a bit. And it's lasting a long time. It's just not healing with routine means of rest or rehabilitation. If it gets out past about 6 weeks, it's probably time for an athlete to have somebody look at the hip. And when we look at the hip, there's a certain presentation clinically of exams that we do that make us suspicious that it could be a labral tear. Gene, these occur a lot in hockey, in soccer, football, and especially in ballet, in dance, where they are maximally twisting, sudden twisting and pivoting on the hip. That catches that cartilage pad rim and tears that cartilage pad rim, and because it doesn't have much of a blood supply, it doesn't heal well, and it just won't go away. So many of these people come to our office, and obviously the concern for us, Gene, is that if they have this torn cartilage and they keep playing and living with it for a long time, not only will they live and have pain all the time, they could have the development of premature arthritis. So some of the people who would wear out their hip early on and end up having to have a hip replacement at a young age, they may well have had a labral tear 20 years ago or something like that. We didn't know this injury very well then, and we do now. So in an office like ours, every month there's a couple of cases that come in with a labral tear. And the problem is, as you know, it doesn't show up on an X-ray as cartilage injuries. Even on an MRI, it's kind of still questionable. So the test that's done, this is the second confusing part about this, is called an MRA, and that's a magnetic resonance arthrogram. An arthrogram is kind of a combination of an MRI, but an injection of dye directly into the hip joint, and then we see if it leaks out around this cartilage rim. Then we know there's probably some tearing of the cartilage rim. But another part of this is while we are injecting the dye to check for this injury, we also have inject a lot of times a steroid and or a numbing medicine to make sure we're in the right place. So while we're right in the joint doing this injection under X-ray, we want to, a lot of people have gone in the last 5 years to doing this injection. And if people say, man, that didn't help me one bit, it didn't make a difference, hey, maybe we're in the wrong joint and maybe it's not exactly a labral tear. And for some people on the flip side, they say, I feel so great, I want to go back and try some more rehab and get back to playing sports again. So this injection has become a really important part of the workup. And then finally, the part that's really progressed a lot as we progress in medicine a lot is the treatment if it is a bad tear. If it's a significant tear of the labrum, they're just not going to be comfortable doing anything activity and sports-wise. And so we fix it. But over 10 years or so ago, it had to be an open incision and a big surgery, and now we've really improved the technique of doing it arthroscopically. And we have a great arthroscopic hip surgeon on our team at Akron Children's who does a lot of these through an arthroscope. And, of course, the question that every athlete's going to ask me is, if I have a scope and I have to have the labrum fixed, when might I play again? And typically, Gene, it's about 3 to 6 months before kids who have torn this cartilage in the hip, known as a labrum, are able to return to sports. So I did want to upgrade your audience on that a little bit today, because people look at me funny when we talk about labrum. They think, hey, that's a shoulder problem. And an MRA versus an MRI, and the newer thing of the injection. Those are a few things that are new in the field of sports medicine to help people with chronic hip pain.
That's excellent. Good to know. Thank you, Dr. Joe Congini from Akron Children's Hospital.